Well, you're most welcome to today's talk. We'll be looking at some definite data that is showing that the vaccination programme is starting to work in the UK. So that's something to look forward to. That would be good news. And also, hospitalisations and deaths are starting to go down in the UK now, as we'd anticipated a month after cases peaked. So we'd anticipated this, and it's exactly what is happening. So I suppose you could say it's good news, but cases are still fairly high. In the United States, all trends are downwards at the moment, but we will be looking at some specific data about the B117 in the United States and the threat that is posing. We'll probably look a bit about vaccines as well. And then we'll finish with the World Health Organization report, if you could call it a report. The team has now left Wuhan, having gone there to investigate the causes of this global pandemic. And the bottom line on that, if you don't want to wait till the end of the video, is don't hold your breath between now and the end of the video, just in case you're disappointed. Now, let's just start off with some data here. It really is quite uncanny the way that the numbers have dropped off in the United States and the United Kingdom together. In tandem in terms of per capita figures. Canada down as well, which is good. But here we see the effect in Portugal of the new variant, and it's dropped off quite quickly with the Portuguese restrictions. The case is what's going to happen in the United States, and France is also similar. You see, France has mostly got the old variants at the moment, and the new variants are just starting to come. The UK variant, is France going to go the same way as Portugal? Well, currently that is an open question. That is very much an open question. Now let's go on to some of this Office for National Statistics specific data here. 9th of February release. Early signs of vaccination immunity. Now let me show you this graphic here, which is really remarkably good news. And here we see that the proportion of, let me just go through this, the highest antibody positivity in England was seen in those aged 80 and over. So we see in the older age group, which of course was the first to get vaccinated, they've got very high prevalence of antibodies now. Now these antibodies here are vaccine-induced antibodies. So this is clear evidence that the vaccine rollout in the UK is inducing an immunological response. So that is really remarkably good news. That's biochemical evidence that this is working. So early signs of vaccination immunity, good. Percentage of people testing positive in the UK is decreased but remains high. And this data is for the week ending the 30th of January. Now, the week ending the 30th of January, 1 in 65 people tested positive. So it's still pretty high levels. That equates to 1 in 846,900 people, 1.55% of the population. And that's down from the week before, the week ending the 23rd of January, where it was over 1 million. And let's just have a look at some of the, I think we can look at some of the overall UK data on this. So here we have cases by specimen date in the UK, and we see going down nicely from January the 1st. Never as fast as we'd like, but cases by date reported also going down. Now, how about deaths? Is this going into lower death rates now? So deaths within 28 days of a positive test, still very high levels of deaths altogether, but the trend is going down. So deaths within 28 days of a positive test, by date of death, we see a definite drop-off in that. So after this month delay, the amount of deaths are starting to drop off, but healthcare is still very stretched. So the number of new admissions are going down. That's good. They're still remarkably high. This is still very stressful levels. But the number in hospital is dropping off very gradually, as we see on this graph here. And as are the number of people in intensive care, that's dropping off gradually as well. And we can have a quick look at the vaccinations while we're here in the UK. So vaccinations from these numbers: first dose 12.5 million, second dose just over 500,000. It is certainly progressing. Obviously, never quite as fast as we'd like, but it is progressing. And I think I'll just show you the COVID symptom tracker app data as well. Here we have the number of cases, daily cases going down, the symptomatic cases going down. That's the graph. I think we'll just take time to watch this graphic today. So the cases were going up in September. Towards the end of summer, things hadn't been too bad throughout the summer, of course. Then the number of estimated symptomatic COVID-19 cases went down with the tier system. Then the new variant came in and it scooted up with the new variant. And then the national lockdown came in and we were able to reduce it a bit from that point. So that does kind of tell the story of the last few weeks, really, doesn't it? Anyway, getting back to the ONS data. So we've said 1 in 65 people in England. That's the weekend in the 30th of January. Wales, it was 1 in 70. Northern Ireland, 1 in 65. Scotland, 1 in 115. Now, deaths the week ending the 29th of January. Now, this is pretty bad news. 8,500 deaths nearly in that time. Second highest weekly figure in the pandemic, behind the week ending the 17th of April. So slightly more deaths in the first wave in that week. That's the highest week of deaths, though, in the second wave. But as we've just seen, that number is starting to go down now. So that week ending the 29th of January will be the record week for the second wave. But still very high numbers, and of course it adds to the overall total quite significantly. For that week, as a percentage of all deaths, COVID deaths were 45.7% of all deaths. And that also is, I'm afraid, an all-time high. The death certificate figure is 111,000, but that's due for an update. Nearly 75% of all COVID deaths occurred among people aged 75 and over. So that means, of course, 25% occurred in those 75 and younger. But we do see that it's mostly older people that we have lost during this pandemic, although a substantial number of younger people have also tragically been lost. Now, I'm going to show you something very interesting here on symptoms. Now, this is from the Office for National Statistics again. And here we have the symptoms that they have recorded. And this is in percentages. So England, we see that cough, fatigue, weakness, muscle aches, the myalgia, the fever, sore throat, loss of taste, loss of smell, shortness of breath, nausea and vomiting, diarrhea and abdominal pain were the predominant symptoms. And although the proportions in Wales were slightly different, this overall order wasn't. And we also see that for Northern Ireland and Scotland, the symptoms, the clinical features are in the same order, although the proportions did vary depending on the population they were being gathered in. So cough, fatigue, weakness, headache, muscle pains, fever, sore throat, in that order. That was the same situation in all 4 UK countries, and I would expect that to be pretty well the same wherever you happen to live. Right. So cough, fatigue and headache, the most common symptoms in people testing positive. Now, this was interesting. England, of people who tested positive, 47% reported having any symptoms. So what this is saying is 53% are asymptomatic. Now, I don't pretend to say this makes sense straight away, because other data we've looked at has shown that it's 20 or 30% of people are asymptomatic, but this is Office for National Statistics data. It's symptoms the 1st of October 2020 to the 30th of January 2020, so it's covering quite a long time period, October to January, and it's saying that 53% of people are asymptomatic. So there you go, that's what the data says. So people who tested positive, 47% reported having any symptoms. In Wales, 55% were symptomatic there, 45% were asymptomatic. Northern Ireland, 38% were symptomatic, high proportion of asymptomatics. That's Northern Ireland there, sorry. And Scotland, it was 47% of people showed symptoms, exactly the same as England. And this was based on analysis cycle of cycle thresholds of less than 30. In other words, this was with people with fairly high viral loads. Now, the reason they did this was to cut out people in the early stages and the later stages. So they were getting people when they were most symptomatic. So there's the UK data to have a look at. Moving on now to the United States. Now, let's just look at the United States in general first of all. And here we see some trends for the United States. So first of all, we're looking at cases, and we do see quite a nice drop off. I mean, it's still high, but the number of cases are reducing. So 7-day moving average, still 116,000, nearly 117,000 new cases on average up to the 7th of February. But it's going down from what it was, is the key thing. And deaths in the United States still remain relatively high. Now, there is some data that's showing that deaths might be starting to drop off or are starting to go down slightly. But here we see that the moving average is still over 3,000 deaths per day, and that is taking us up to the 8th of February. So that is reasonably up-to-date data, today being the 10th of February. Now, the other thing I wanted to show you here from the US, this is a new tracker I've found. Now, I've only just started looking at this Helix group. They seem to be contracted by the CDC. And this is live on their website. And this is prevalence of the UK discovered B117 variant. So we see that the highest variants at the moment are detected in California and Florida, but you can probably spot your state. Now, that's not saying that places like Washington and other states won't have this, but this is where it's been detected. And if you look on this site, it does give you huge amounts of information about how they know all that. Quite interesting. But the testing, this is still based on limited testing in the States. So we know that this is incomplete because we know that this virus has actually been detected in 40 states. So just a new tracker site, incomplete at the moment, not enough data because it is in 40 states. So we'll keep an eye on that, and if it's brought up to date, that'll be good. If not, we'll drop it, as we have done other information sites in the past. So CDC data we've looked at. Now, the past 7 days, this is Washington Post analysis. New and daily reported cases down by 23.5%. That seems about right. New and daily reported deaths, they're saying, down by 15%. Now, that will be right. It's just that it's not showing up yet on the graphics from the CDC. COVID-related hospitalizations down 14.1%. So that's the number of people actually in hospital. 79,179. That's the number of people in intensive care, and that's the number of people being ventilated at the moment. And the good news from the States is the test positivity rate is down to 6.6%. Now, if it gets below 5%, that is below the epidemic threshold. But it's, that's about half what it has been, so that's pretty good news. The question is, are these new variants going to mess everything up? That is the big question, as they did in the UK. Vaccinations in the States going reasonably well. Since the 14th of December, 44 million vaccines given, and 2 doses have been given to over 10 million, which is 3.12% of the population. So still an awful long way to go, but the trend in the States is good. Now, I'm just going to have a quick look at global vaccinations before we go on to look at some other vaccination data information. So here we are. Canada, very, very low, disappointing. 3 doses per 100 people. They've had a lot of supply issues in Canada, of course. United States, much better, 14 doses. So 10.2% of the population got at least 1 shot. 3.1% of the population got 2 shots. Europe still pretty low levels. The UK slightly better. Now, one thing that is concerning me is Russia and China are both exporting vaccines around the world, and yet their own people, Russia, for example, 0.55 doses per 100. They haven't vaccinated 1% of their population yet, and yet they are exporting vaccine. China, likewise, very low vaccination levels. If you live in Australia, talk to your politicians and say, "Oi, mate, get your act together." They really need to get on with things in Australia. Leading the pack, we have Israel. So 39.5 got at least one shot, nearly 25% fully vaccinated. United Arab Emirates also was doing quite well, wasn't it? Yeah, 42 doses given per 100. And we're going to be looking at Serbia, which is there. And that's also doing fairly well also. And we're going to look at that now and why that is. Good. Now, Hungary and Serbia. I've put them together for vaccination purposes here, because they're both importing vaccines from China and Russia, as we've said. And let's just look at these figures here. Israel vaccinating a lot of people who've had at least one vaccine. United Arab Emirates also doing well. Then the UK, then the US, then Serbia, then Denmark, and European countries lagging quite woefully behind, it has to be said. And there are all the references for the global vaccine trackers we've been looking at. The one we're looking at just there was that Bloomberg one, which does seem to be reasonably up to date. Now, we've said here that Hungary and Serbia are getting vaccines from Russia and China. That concerns me because, well, it's good that they're getting it, but it looks like people in Russia and China aren't being vaccinated as quick as we would like them to be. And also, if you're into geopolitics, it's impossible not to be aware of the geopolitical implications of Serbia just on the edge of the European Union and Hungary in the European Union getting their vaccines from China and Russia and not going via the European programme, which they feel has let them down. So interesting. Beyond the remit of this video, I'm pleased to say, but it's impossible to ignore the implications of that. Now, the World Health Organization team in China. Now, I'm going to try and go through this and not express emotion. You will probably start feeling an emotion like anger or rage, but we'll go through it as objectively as we can. Tuesday news conference led by Chinese health officials. Now, this is the only release of this I can find, and it's a televised video conference of the Chinese-led team and the World Health Organization team, and it's bilingual, and I watched as much of it as I could tolerate, and then I just couldn't watch anymore. But there's quite a good pre-say in various popular newspapers as well, but that's the only original source, so there's no written report as yet. Now, this news conference was coordinated by Chinese officials about the mission to Wuhan, and it actually turned out that it was inconclusive. They didn't come up with any definitive cause of the pandemic. Chinese WHO team. So the Chinese and the World Health Organization, good to see that they are collaborating. Unity is good. They are collaborating together. Coronavirus most likely jumped from bats to an intermediate species. I mean, wow, what a spectacular finding. Dear me, who would have thought it? So they've come up with that. And before I go on, I just want to remind you that if you're living in the United States or the United Kingdom, you paid for these guys' airfares. And you paid for this because we're the people that support the World Health Organization, and they come up with a stupendous finding like that. So so it starts off insipid and weak, and goes downhill pretty rapidly from there. They say that the virus could have been spreading around the world before it erupted in Wuhan in December 2019. In other words, this is the World Health Organization in collaboration with the Chinese authorities saying this virus may not have arisen in China. Let me just say that again. The World Health Organization is saying, as I read this press conference, that this virus may not have arisen in China. Try and control it. I know. I'm feeling it as well. WHO team reiterated that it's possible that the virus was carried by frozen food, especially frozen fish. And of course, the team made a big song and dance about visiting that frozen fish place where frozen fish are imported. So it could well have been that the virus arose. The strong implication of this is that the virus didn't arise in China at all. It was imported into China on frozen food. Let me just remind you, this is coming from the World Health Organization that you and me pay for. The joint Chinese and World Health Organization team emphatically ruled out a lab mishap after talking to the lab in Wuhan. So they went to the people in the lab in Wuhan, and I don't know what they said. They probably said something like, could the virus have escaped from your lab? And the people in the lab in Wuhan said, oh no. So the World Health Organization team seemed to say, oh, that's all right then. Anyway, however they found that out, they emphatically ruled out a lab mishap. Now, in logic, proving negatives is kind of difficult. I can't prove to you that aliens have not already landed on this planet. I can't prove to you there is not a Loch Ness monster. But I strongly suspect that aliens have not landed on this planet and are living amongst us, and I strongly suspect that there is not a Loch Ness monster, but I can't prove those negatives. But the World Health Organization, because they're clever, they can prove that negative. China's Global Times were pleased because it finally put an end to American conspiracy theories about this arising from a lab in China. World Health Organization visit, according to the China Global Times, showcased China's positive scientific cooperation and attitude. Xing Gang, chief epidemiologist at the Chinese Center for Disease Control. Apologies, sir, for pronouncing your name. I'm sure it's wrong. But anyway, he said this: other locations in the world, particularly the United States lab, must be investigated next. So the World Health Organization, you see, has ruled out, it emphatically ruled out that this virus came from a lab in China. Therefore, we should be looking in labs in the United States to see if the virus came from labs in the United States, according to this epidemiologist at the Chinese Center for Disease Control. And his rationale here is historically the United States launched biological and chemical warfare, apparently. The World Health Organization is now expected to move on to Southeast Asia to explain viral origins. So it sounds like you and me are going to pay for a World Health Organization team to go to Southeast Asia to see if the SARS coronavirus 2 originated in Southeast Asia, because it looks like they've pretty well eliminated the Chinese possibility. Now, we could go on and on about this, and I haven't had time to look into all the details of it, but this bloke here seems to be one of the bosses in the WHO team. And according to Washington Post, he is associated with a group called Eco Health Alliance. And apparently they coordinated US grant funding to the Wuhan Institute of Virology. Now, you and me might think that that was a conflict of interest. Well, this is from Richard Ebright, microbiologist in Rutgers University. I think that's in New Jersey. He does think this is an apparent conflict of interest. And he says that any institution or country that wanted to vindicate itself would have quickly moved to make available all its databases of genetic sequences and strains. Makes sense to me, Professor. Provide lab notes, that makes sense to me. Record records and private interviews with researchers and research staff, that makes sense to me. talk to waste removal and janitorial staff, of course, were very important. And none of that happened or was even requested by the World Health Organization team. So there you go. That seems to be the consensus of opinion from the World Health Organization Chinese collaboration team. Shall we look at some pictures? Always like looking at your pictures. Now this one is from Etta, who is a physician in New York, and we had the privilege of talking to her earlier on. I'm delighted to see she's being vaccinated now. So there we go. And it looks like she's got a sticker. I got vaccinated today. Fantastic, Etta. I am delighted for you. I wish I had such a sticker. So excellent, Etta. Thank you for the picture. And thank you for talking to us way back at the start of this pandemic. But I remember it was very interesting to have you on the podcast or wherever this is. Now this is Richard in Norwich. And this is the team that Richard works with. Now, it's quite interesting because I don't know which one's Richard, actually. I assume it's that one or that one. But he was on the Novavax trial. And he got a job on this vaccination team. And therefore needed to be covered because he was public-facing exposed. And the Novavax people unblinded his data, and it turned out that he did have the actual Novavax vaccine, not the placebo. Therefore, he didn't need to get the vaccine to carry on with his work. So always great to see people happy in their work, and good to know that you took part in the trial and you were in that lucky 50%, Richard, that actually got the vaccine. I guess that's Richard coordinating visitors to the vaccine centre in Norwich. So there we go. That is us for today. I hope that was helpful. It's a race now, isn't it, between vaccines and new variants. Let's hope the vaccines win. And I wonder if one day we'll find out where this virus originated. Maybe historians might. In my lifetime, I think it might not. I think I might die wondering that. But let's hope we do find out at some point. You know, it's interesting. I don't want to prattle on, but you know, are governments around the world going to accept this? You know, are the Biden administration going to lay back and say, "Oh, well, we're not going to find out"? You know, are they going to accept this report? Is the Johnson government going to accept this report? Or the European government's going to accept this report? That we've had this pandemic, but we're never going to find out how it occurred. Are our governments going to accept that, or are they not going to accept it? I don't know. Anyway, thank you for watching, of course.